Here we're going to get into an exercise called pelvic tilt, similar to the setup of the supine breathing. So you get to be on the floor, feet nicely placed. It's a gentle movement. We're not going to see huge movements, particularly if you've got a bit of a sticky pelvis, as it were, and you're not seeing a huge, if you're stuck in one position. So it can be a little bit more subtle. In fact, most people that are going through this, if you're seeing huge movements through that pelvis, it may be coming from somewhere else, but we'll talk about that in a second. So we lie down again, feet nicely placed, relaxed, open airway, and then we'll take our fingers this time, instead of on the ribs, we'll put them onto your hip bones. Okay, this isn't how I normally have my trousers, but okay, onto the hip bone. And what we're going to use is our hands here to kind of approximate the movement that we want, which is these hip bones rocking forwards or moving forwards this way, and then bringing them back towards, say, your shoulders. Okay. As we go through this movement, what we want to do is just be aware of the fact that, like I said, there's not a huge amount of movement that's going to come from the pelvis, at least initially. So to just watch out that you're crunching too much and really trying to drive your lower back into the floor. It is going to touch the floor, but we don't want to feel such a hard contraction through the abs or a lot of pressure through the lower back. Similarly, we could even see some people lifting their glutes to try and move that pelvis again. That's not kind of what we want. And then as we rock forwards, just being aware that we are seeing this movement from the bones moving forward rather than just a lifting up of the chest or the lower body. So it can be subtle. You go through about 10 reps, and once you start getting the movement, and you'll see through mine that it's not huge. Okay. Then we can start to incorporate a little bit of breathing. Okay. So from a neutral position here, bones pointing up, we're going to take a breath in, and that's our signal to allow the pelvis to rock forward. So it's a breath in through the nose, and then exhale through the mouth, long, and feel that pelvis come back towards the shoulders. Even if it only comes back to neutral, that's fine. You feel a good sensation would be to feel around about that sort of pelvic floor, Kegel muscles, if you've done those kinds of things. Just using the breath and the cycling of the breath. Breathe in, you feel that space open up, and then certainly let the exhale initiate the movement of the pelvis back towards the shoulders, rather than getting here, dumping the lower back in, and then exhaling. So 10 to 15 reps here, subtle movement, work it in with the breath.